Hi everyone, my name is Joan Noelker. I'm an emergency physician at Washington University in St. Louis. I work in both pediatric and adult hospitals as well as a third facility that's a smaller ED that sees all comers in the same emergency department. So I get to talk to a whole variety of patient types. So I briefly just wanted to give my little spiel about scripting for patients, which is extremely important. We often think that our job as patients come in is to identify a problem and to solve the problem. And if we don't think that there's a problem, then we're done and they can go home. But a huge part of patient evaluation and patient management is figuring out, why that patient came in and what they are concerned about. Because if that is not addressed, even if you've identified that there's no critical problem going on and they're safe for discharge, if you don't address whatever they're worried about or whatever their concern was, you're going to have a challenging interaction, or that person may bounce back to another provider if they don't trust you, if they don't think that you were taking them seriously, or if they don't think that their actual concern or their problem was addressed properly. So, as has been said by some of the other folks in this series, using very clear layman's language is very important. Don't say abdomen. I don't even use certain kind of larger vocabulary words. I keep it as simple as I can, just to make sure that everybody is going to understand me. Not that I think that people's education levels are poor all the time, but even if you're very educated, it's still easier for people to absorb things if you're using very plain, simple language. I will just do the simple things, which took me a shocking amount of time to figure out, which is ask them what they are specifically concerned about. From doing that, I've kind of learned to anticipate what people might be worried about. So basically, anyone coming in with chest pain or any parent bringing in a child with chest pain is always concerned about a heart attack. That's almost always their number one concern. So if you don't address that, then again, there's going to maybe be some mistrust, or they might think that you've missed something. Anyone bringing in a child with a head injury is worried that that kid's going to have a head bleed and not wake up. That's their main concern. They're not actually wanting a scan. They're not actually wanting imaging. They're just wanting to make sure everything's okay. And so if you get ready and know how to anticipate those things, you can preempt some of those conversations. And then if it hasn't come up, just straight up ask them, like, what was your main thing that you were worried about today? Is there anything that I haven't discussed already that you were concerned about? And then often that's, the hand on the door conversation can be had with the thing that they were actually concerned about if you didn't catch it at the beginning.